You may have heard the term ageism, but what exactly does that mean? Ageism is defined as the stereotypes, how we think, prejudice, how we feel, and discrimination, how we act, directed towards others or oneself based on age. Ageism can happen at any stage of life. For older adults, ageism can be bad for their health and the quality of care they receive. It also gets in the way of living their best life and contributing to society. Here's how ageism can show up in healthcare settings. Assumptions about health based on age. Healthcare professionals may assume that certain symptoms or conditions are simply a natural part of aging, without thoroughly assessing or diagnosing the patient. For example, an older adult's complaint about fatigue might be dismissed as just part of getting older, when it could be a sign of a treatable condition like anemia or heart disease. Discrimination in treatment and care. Healthcare providers may unconsciously prioritize certain treatments without considering the priorities and preferences of their older patient. Older patients are less likely to receive intensive or complex care regardless of the severity of their condition, their capacity for treatment, and what matters most to them. Older people also experience discrimination in their access to preventive measures, such as mammography screening. Underrepresentation in clinical research. Older adults are often underrepresented in clinical research studies. This may be because the study doesn't include older adults at all, or because the stipulation of the study ends up excluding most older adults. There are age-related biological changes to how medications are processed, absorbed, and cleared from the body. Without older adults participating in clinical research, we don't know whether certain treatments or interventions are effective for them. Ageism can also affect communication. Healthcare providers might mistakenly want to make decisions on behalf of older patients or with their companions, instead of engaging directly with the older adult about their own care. Language and cultural differences can add to the miscommunication. This may lead to the provider offering limited treatment options or even overtreating an issue because they have left the patient out of the conversation. Ageism in healthcare leads to older adults using more healthcare and increases healthcare costs. It's estimated that ageism accounts for $63 billion spent on healthcare each year in the US, and that's just for the 8 most expensive health conditions. Not only is ageism in healthcare expensive, it's harmful because it can lead to delayed diagnosis, misdiagnoses, delayed treatments, and inequitable care. It also reinforces negative biases. We all have biases. It's up to all of us in healthcare to educate ourselves so we can recognize our biases and reduce ageism. Ageism hampers the health and care of older people, reduces their quality of life, and minimizes their contributions to society. Promoting age-friendly healthcare involves acknowledging the unique needs of patients and ensuring that clinical decisions are based on individual health needs, not assumptions tied to age. For more information about ageism in healthcare, visit our website, geron.org.